Hello, my name is Yuna. I'm an Operation Diabetes co-chair. We are going to demonstrate how to properly do the finger stick when you are doing blood sugar screening on a patient. Before you do the finger stick, make sure each patient signs the consent form. This is important. Do not touch the patient until he or she has signed the consent form. Ask the patient if they have been diagnosed with diabetes and if they have eaten anything in the last 8 hours. If they have not been diagnosed, explain to the patient that you will fill out a diabetes risk assessment, and then you will check their blood sugar. You don't need to fill out the diabetes risk assessment form if the patient has been diagnosed with diabetes. After obtaining a consent form and completing the risk assessment, record patient general information, fasting, non-fasting state, and risk assessment score on the event log sheet. Then move on to the finger stick.
Hi, I'm Chu.
Hi, I'm Julie.
Nice to meet you, Julie. I'm a student pharmacist from UMKC School of Pharmacy. I'll be doing your blood sugar screening today. Before we get started, I would have you sign this consent form, which is saying we're doing screening. Nothing's gonna get diagnosis today. You can read through it, print your name, and sign it right there, and I can be your witness.
Sure.
Thank you, Julie. I'm gonna ask you a few questions. Have you ever been diagnosed with diabetes before?
No, I haven't.
Okay. Have you eaten anything in the past 8 hours?
No.
Alrighty. So before we do the finger stick part, I'm gonna have to go through this risk assessment form with you. Is it okay?
Yeah, sure.
Now we are going to demonstrate the finger stick. Let the patient know what you are doing to them before you do it. Let them know that you will now need to obtain a blood sample in order to check their blood sugar. In order to do that, you will need to prick their finger. Let them choose which hand they'd like to use. If they don't care, choose their non-dominant hand. Disinfect your hands with hand sanitizer. Put on a pair of gloves. You will use a new pair of gloves for each patient. Use an alcohol swab on the fingertip of their choice to clean the area and increase the circulation for blood flow. Let the alcohol dry. If you do not let it dry fully, the alcohol can affect the blood sugar reading, making it artificially low. Remove a test strip from the vial. Insert the strip into the blood glucose meter and it will automatically turn on. A blood drop will appear on the screen and that shows the meter is ready to read. Let the patient know they will feel a little stick. Milk the finger if you need to in order to get plenty of blood flow to the tip. Apply pressure and prick the edge of the fingertip rather than the pad of the finger. This will minimize patient discomfort because there are less nerve endings on the edges. You now have a little bit of blood sample. Squeeze the finger just a little bit to get the amount of blood you need. Touch the tip of the strip to the blood drop. The meter will give you a result. Apply a cotton ball to the pricked finger to absorb any excess blood. Apply a Band-Aid to the finger if the patient would like one. The lancet and any items that are soiled with blood are to be put in the sharps container. Everything else can go in regular trash, including the test strip and cotton balls and other items that have small amounts of blood on them. You will use the interpreting results packet to determine the results of the reading and educate the patient about ways to prevent or slow the development of the disease and the signs of hyperglycemia. If they already have diabetes, you can discuss ways to manage it effectively in addition to educating on signs of high and low blood glucoses. Record the reading result. Indicate a referral on the event log if the preceptor or pharmacist comes to speak with the patient, and they are instructed to visit their primary care provider. Thank them for their time and use every opportunity that presents itself to advocate for pharmacists as healthcare providers.